afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're joined today by Acting Mayor of London, Josh Morgan, the Warden of Middlesex County, Kathy Burkhart-Jessen, and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackey. We'd like to welcome the media who are in attendance for this afternoon's briefing and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, those watching on the CTV London website, and those listening on News Talk 1290 CJBK. We'll get to the opening statements right away, and we'll start with the Acting Mayor of London, Josh Morgan.
Great, and thank you, Elizabeth. Really appreciate being here today. I'm actually in the middle of a Corporate Services Committee meeting, and I've stepped out to do the media briefing, so you're going to get a little bit more off-the-cuff comments from me today. I first want to say I'm hoping everybody had a great weekend. There were two phenomenal events out there in the community, the North America's Greatest Air Show and an Olympian celebration at Labatt Park. You can probably tell from me that I got a little more sun than I perhaps should have, but I do appreciate that Londoners were out. They were safely enjoying activities in a socially responsible way, and I want to say thank you to the organizers of both events for ensuring that public safety was at the top of the organization of those. There's been a great deal of discussion that has taken place over the weekend on issues of vaccine mandates and vaccine passports. We've heard a number of these mandates, proof of vaccination from organizations such as Budweiser Gardens, Western University, and others. We're also aware of several organizations that have called on the province for a centralized vaccine passport system, including the Ontario Chamber of Commerce and several regional health units. I will say at the Corporate Services Committee, we are in the middle of a debate on the city's vaccination policy related to our employees. There has certainly been discussions about how far that policy should go and whether or not the city should consider additional steps. Those are the ongoing debates that we are having as a council and discussions that we have to have as a community. I will be very clear on this. A municipal government has very specific obligations on how and when it provides services to its residents. There have been few instances, if not none, outside of the provincial restrictions where we have restricted access to our facilities to the public, given that we serve so many vulnerable populations across the city. And that makes for this to be a very difficult discussion, one where we have to be exceptionally thoughtful about the legislation we are responsible for, regardless of what our own personal opinions may or may not be on vaccine mandates or passports. We have to ensure that we are providing services to as many residents as possible under our obligations under the various acts. This will certainly be a thoughtful discussion. Our city manager in the development of our current policy has liaised with the health unit, our union leadership, as well as our legal staff. And today, Corporate Services Committee will also be receiving legal advice on this issue. I cannot predict how the rest of the discussion will go until I return to that discussion after 2:30 today, but I can tell you councillors are trying to engage in a very thoughtful approach to being as safe as possible while protecting the public in our provision of services, which is the most important thing that a municipal government does, is provide services for its citizens. So certainly a very challenging discussion, but one we are trying to approach as thoughtfully as possible with the consultation of our very important health practitioners, as well as those stakeholders at the city. With that, that's all I have for now, and I'll turn it over to Warden Burkhart-Jessen for her statement. Thanks.
Great. Well, thanks so much for that, Deputy Mayor Morgan. You know, it's been a few weeks since I've been able to join you for a briefing, so it is great to be with you on this beautiful Monday afternoon. And as we head towards the unofficial end of summer, I know that we will all be taking advantage of the slower pace of summer until the routine of autumn is upon us. It has been so wonderful the last month as I've had the opportunity to tour the county, to see people out and about and enjoying activities once again. In my own home community of Lucan and Biddulph, the last 2 weekends have provided opportunity for our community to get out and attend a couple of events, of course, safely. And that these are events that up until a few months ago, we were restricted by and we couldn't enjoy. You know, we saw folks the last couple of weeks reacquainting themselves with people that they haven't seen in over a year. And it's been refreshing to see people enjoying themselves and feeling like we are closer to getting back to normal. As the September routine looms in front of us, part of that routine will have to continue to be the wearing of masks, being mindful of our physical distancing, our good hygiene practices, and of course, if you haven't already been, getting vaccinated. We must continue to be vigilant with our personal activities to ensure that things don't slide. As was amplified earlier this year, our healthcare system is so connected. It doesn't take much to put it into a precarious state. Routine tests and procedures are in a backlog. I actually experienced that this morning as I went to book an annual routine exam, and bookings are 6 months out. We must still continue to do our part as to not further endanger the healthcare system and the network that we so much depend on. And as I've mentioned so many times over the last year, and many months, we must be checking in regularly with our mental health. As I've been speaking to more and more people who are getting out with more frequency and attending more public events, some are experiencing moments of anxiousness and weariness. It has been a long time since we have gathered in groups and crowds, and some have shared with me that something as simple as going to a local farmer's market or an outdoor movie night have brought on waves of panic and nervousness. Be mindful of that in yourself, in your family and friends. And while some of us are just jumping back into the activity as if nothing has happened, others might be struggling. Recognizing that and helping a loved one through it, well, we have a lot of healing to do as we work our way out of this pandemic. And it's great to see you, Dr. Mackey, so I'll hand it over to you.
Thank you very much, Madam Warden and Mr. Deputy Mayor. And thank you for the whole team who was able to provide some coverage so I could take the last couple of weeks off. Very much appreciated that, and looking forward to getting back into things. Speaking of getting back into things, we are very much deep in a fourth wave. I'm going to share, we had 13 cases diagnosed yesterday, but I'm going to share some information puts that into context, and it's really about the testing volume that we're observing at the moment. And this is true provincially as well. The weekly case test, number of tests being done are around 5,000, whereas at the peak of wave 2 and wave 3, we were testing over 10,000 people per week. What that means is that if we were still testing at this rate, we would likely be seeing double the number of cases that we are now. If you look at the provincial numbers, you see that play out in the percent positivity. So case counts are climbing, definitely, nowhere near the peaks of wave 2 or 3. If you go down to percentage positivity, but again, testing volume is very low compared to those peaks. So if you go down to percent positivity, you see that story play out in another way, which is that the climb in percentage positivity, or percentage of tests that are coming back positive, is much steeper than the case counts. And again, if we're seeing wave 2 or wave 3 level of testing, the case counts would be much, much higher. So I think that's important to bear in mind. The other side of that coin is that we're not seeing the deaths, the hospitalizations, or the ICU counts increasing as dramatically as we did those other waves. And that's important because, again, it's telling the story of the effectiveness of the vaccines, but not just of the effectiveness of the vaccine, the effectiveness of targeting the vaccines at the highest risk populations. Here, we're not seeing much of an increase in death counts at all. Provincially, you're not seeing much increase. In fact, if anything, flat for the last several weeks while cases climbed. And that's because we have our most vulnerable population, our elderly, long-term care, and people with chronic conditions, very, very, very highly vaccinated, well over 90% in those groups. So that's tremendous and really will put us in a good position from the point of view of the healthcare system and mortality, which is, goal number one in a pandemic. That said, we will see a lot more cases, and we'll see cases particularly among unvaccinated populations. The two outbreaks that we declared recently, Delilah's and Lost Love, are great examples where in the case of Delilah's, we have 27 positive cases. Only 3 of those individuals are fully vaccinated. So, almost 90% among people who are not fully vaccinated. Lost Love, even starker numbers. Of the 15 cases there, only 1 case was fully vaccinated. So, 14 out of 15, or over 90% of those cases were not fully vaccinated. Again, you're going to see that spread in those unvaccinated populations. The children are the other place that we're concerned about. We've had tremendous uptake, better than provincial average in terms of the 12 to 17-year-old population. And now, some of the 11-year-olds as well who are turning 12 this year. But none of the kids younger than that are vaccinated. And when we first started seeing the Delta variant popping up in GTA in wave 3, they would see situations where they would test around a case in a childcare facility, and 100% of the kids would come back positive. So we know that this Delta variant is much more infectious in young people, and that there's a definite risk among kids. So that makes it so much more important that all of us adults who have contact, and adolescents who are now eligible, who have contact with those children, make sure that we're vaccinated so that we can put a ring of protection around them and prevent as much spread there as possible. A reminder that we are at Masonville Mall this week with a vaccine clinic near the food court. So as you're doing your back to school shopping, please do stop in and get a first or second dose there. That's it for now, Beth. Happy to take any questions.
Thanks very much, Dr. Mackey, Warden Kathy, and Acting Mayor Morgan for those opening statements. We'll get to the questions right away. We do have a couple in queue here already. And once again, if you're a member of the media and you're thinking about or on the fence about asking your question, please do get into the question forum as soon as possible. Sometimes there is a bit of a delay there, so get it in as soon as you can. Right now, we'll start with the top of the questions here. Jennifer Beeman from the London Free Press has a question for you, Dr. Mackey. Dr. Mackey, the province is expected to announce the details of a vaccine passport system tomorrow. Will this initiative make people safer from the COVID threat in public, or is it better understood as a way to boost vaccine uptake?
I think so. Those are two sides of a coin, Jennifer. I mean, if we see boosted vaccine uptake, we are going to see a safer population. So I really see them going hand in glove. If we're able to limit access to facilities to those who are fully vaccinated, that will make a bit of a difference. But as we see an increase in uptake, which we surely will, and I think we're already seeing that with how much discussion there has been about vaccines becoming mandatory and actually becoming mandatory in some places. You'll continue to see growth in the uptake as those passports become available. This is something that our local Chamber of Commerce has called for. The business community truly needs and desires in order to enforce vaccination policies that are there to protect their staff and their customers. So we've heard those same rumors that you have and are very happy to see this coming about.
Thanks for that response, Dr. Mackey. Another question here from Jennifer Beeman with the London Free Press. It is for you. Dr. Mackey, cases have been rising in the London area. How much higher do you expect they will go once school returns?
Yeah, I mean, one thing that we see when school returns is because of the mandatory testing policies, you uncover a lot of cases that would have been, acquired before school or in school. So we're definitely expecting an increase in cases around the school reopening. Again, with masking in place and many of the other protocols, the spread in schools is limited. It has been limited in the last school year. The big change now is Delta variant, and it's not clear. Certainly we will see more spread in the elementary students. Previously high school students were higher risk than elementary students, and we saw many cases of spread in high school, not as many in elementary. With the Delta variant, on the one hand, increasing the risk for the younger kids, and on the other hand, the high school kids getting vaccinated, I think you're going to see that flipped on its head. Again, so important for all of us to have contact with those young children to get vaccinated to protect them.
Thank you, Dr. Mackey, for that response. Another question here from Jennifer Beeman with the London Free Press. Dr. Mackey, are you expecting Western's mandatory vaccination policy will prevent a repeat of the last school year, when outbreaks and case spikes were not uncommon?
Well, first of all, I think it's wonderful to see the leadership that Western has taken, which is now really, Western has led all of the Ontario universities with support from the Council of Ontario Medical Officers of Health into mandatory vaccination policies. And that's a real positive development. In speaking with some of the modelers earlier this month, they were identifying communities ours where there is a high influx of post-secondary students being at particular risk of those sorts of outbreaks if mandatory vaccination policies were not in place. And I think this really does move the needle. Will we see spikes? Certainly. Again, Delta variant is going to overwhelm some of that vaccine protection, but I don't think it will be anywhere near what we saw last year.
Thank you very much, Dr. Mackey. Our next question comes to us from Jane Sims with the London Free Press. It is for you, Dr. Mackey, and it is one of our favorites. It's a 2 to 3 part question here, so I'll take a deep breath and read this. Thank you, Jane. With school starting next week, Dr. Mackey, is there anything that the health unit can do to push for mandatory vaccinations among students and teachers? You have said before that the health unit would be consulting with local school boards. What have you told them? Can public health have any sway on the current provincial policy that doesn't bar unvaccinated teachers from a classroom?
Well, I appreciate the questions, Jane. Let me start with saying that I think that the current provincial policy really does help, where you have the option of vaccination or testing. That really does help to increase the safety. Certainly, it creates some incentive to get vaccinated, but also, regular testing can help pull some of those cases out before they affect children and others in the schools. So those are real positives. The school board, we've been in regular contact. We have a school health team that is, almost daily contact with the schools, helping them to make sure that their classrooms are as safe as possible, and that we can support them with good advice on policies and procedures as much as possible. The Thames Valley School Board has asked myself and the medical officer at Southwestern Public Health to attend their board meetings regularly. We'll be there tomorrow night. What more can we do really depends on what we see in schools. If we see significant spread that is generated by people who aren't vaccinated but are eligible, then that creates an opportunity for the health unit to take more dramatic action. Right now, we know that most teachers are vaccinated. The unions are telling us it's over 90%. We don't have perfect data on that, but certainly believe that we may get better access to that vaccination rate data among teachers and students. And if we have evidence that unvaccinated people in schools are spreading COVID, that puts us in a good position to issue orders or other directives that are more definitive there.
Thank you very much, Dr. Mackey, for that question. Another question here from Jane Sims with the London Free Press. It is for you, Dr. Mackey. During the current wave of infections, how many of those diagnosed with COVID-19 have been school-aged children, and how many have ended up in hospitals?
Yeah, I appreciate the question, Jane. We haven't pulled that data by wave. So, I mean, we know that the number of pediatric cases has continued to be quite low. I couldn't give you an exact stat right now.
Thank you very much, Dr. Mackey. Our next question comes to us from Jacqueline LaBelle with 980 CFPL. This question is for you, Dr. Mackey. Dr. Mackey, Ontario has removed runny nose from its list of COVID-19 symptoms, requiring a child to stay home from school or daycare. Do you agree with this?
Yeah, I mean, this is really about trying to have our lives be as normal as possible in spite of this challenging pandemic. It's a risk calculation. Runny nose does not, obviously it's not specific at all, right? So runny nose, vast majority of cases is not going to be COVID. We're talking over 99%. So from that perspective, I think it's a reasonable decision to make. Obviously, it does increase one type of risk around, potentially a small number of COVID cases coming into school, but there are other risks where people who are staying home unnecessarily have mental health impacts. There's potentially financial and employment impacts around people that need to take time off. So having every child who has a runny nose be forced to stay home until they get a negative COVID result, it's not without risks of its own.
Thanks very much, Dr. Mackey. And while we're on the topic of COVID-19 symptoms, Sophia Rodriguez from CBC-London has a question for you here. Dr. Mackey, where do you recommend people get tested for COVID if they don't have symptoms this fall? Sophia is referencing and thinking of people who are returning from travel and maybe worried about, picking up COVID along the way. And are there plans for more assessment centers or any other options for people?
Yeah, the best place to go if you don't have symptoms would be a pharmacy. Lots of pharmacies, I believe most pharmacies in the area are offering COVID testing, and so they can help you out there.
Thanks very much, Dr. Mackey. Now, Jacqueline LaBelle has a question here in the queue. It does touch on some of the numbers you shared about the Delilah's and Lost Love outbreaks. Jacqueline LaBelle from AM 980 CFPL. Dr. Mackey, but Jacqueline would also like to know, in addition to the update on the case counts associated with Delilah's and Lost Love, are these outbreaks still ongoing or are they declared over? What are the timelines?
Yeah, great question. Delilah's is over. The situation with these facility-based it's different from other, healthcare facilities where you may have the same people who are, living or residing in the facility for long periods. So like in a long-term care facility or hospital, if you have an outbreak, you've got the same staff, the same patients there for some time. And so you may have people who are positive that you can't move out of the facility and have to live there. And so the risk of an ongoing spread is much higher. Whereas in these sorts of facilities, it's almost like a point in time sort of outbreak where somebody who was positive came and infected a bunch of other people who happened to be at the same time in the same place. But it's not like they are staying there and at risk of infecting others. So what we typically see in these sorts of situations is you see a burst of cases. There's potentially a second increase in cases as you test more people, but you don't typically see an ongoing spread. The exception might be where you have an operator, but we're testing those people and getting them out of the workplace if they're positive. So we don't anticipate ongoing spread there, and we haven't seen a lot of secondary cases beyond. There was a link with another small cluster in the community, but it was prior. It was probably, the index case, the person that brought the infection over to the nightclub. I think it is important to highlight, though, that these sorts of environments where you have people mingling in close contact, even when masking is in place, they remain high risk. And so, every time you choose to go into a bar or nightclub or someplace where you know you're going to be in close contact with others, you are potentially taking a risk, even if you're vaccinated, even if you're masked. So I know we're in the stage of getting back to as normal as we possibly can, and I understand that. And I understand, the need that these facilities are filling in our social and cultural environment. I think it's just really important that people using these facilities go in with eyes open to the risks.
Thanks very much, Dr. Mackey, for that response and that explanation. It was very helpful. That leaves us with no further questions in queue this afternoon. So I'd like to thank everyone for joining us this afternoon, Acting Mayor Morgan, Warden Kathy, Dr. Mackey, and to the viewers who tuned in and the media as well this afternoon. We'll be back to join you on Thursday at 2 o'clock. So until then, have a great day. Thanks.